guys, I'm Shanmugapriya, your lecturer from SNS College of Allied Health Science. Today we are going to see a case presentation on the topic humeral fracture. So here is the patient information. So here our patient is of 58 years old, a female whose occupation is a retired clerk and hand dominance is right hand, and the date of presentation is about the time. So presenting hospital in the emergency unit. Chief complaint is pain, swelling, deformity in the right wrist after the fall. Next, the history of the past illness comes. The patient fell at home earlier today, landing on her outstretched right hand while rushing to answer the phone call. She felt sharp pain. So the pain grade is about 6 to 10. Immediately noticed swelling and saw her wrist bend oddly. She arrived at the hospital within an hour. No numbness or other injuries reported initially, but she struggled to move her fingers later. Her past medical history are that she has osteoporosis diagnosed 4 years ago and a mild hypertension managed with medication. No diabetes or prior fractures, no allergies are known, and the medications she has taken are calcium and blood pressure pills. So the next one is physical examination, and here the vital signs were that is blood pressure is about 130 to 80 mmHg, and her heart rate is 82 beats per minute, and normal temperature is normal. The wrist is swollen and bursy with a dark dinner fork deformity. Dorsal angulation. Painful to move, limited wrist and finger motion. Nerves or blood flow. She has normal sensation and pulse in hand. No signs of nerve damage. And the investigations taken were X-ray, blood test priorly. So it shows a displaced distal radius fracture in Colles type with backward tilt, no ulnar involvement. And then the blood test shows normal but no infection also. In the diagnosis, we found that she has displaced Colles fracture of the right distal radius. And treatment, initial care was pain relief with medication and a splint to stabilize the wrist. Surgery, the next day, a volar plate was used to fix the bone, open reduction and internal fixation. So it is RF case due to misalignment, and the recovery was within the splint for 2 weeks, followed by gentle exercises to restore movement. And then the outcome and follow-up. For the first week, she has pain reduced, no nerve issues, and in the 6 weeks, the X-ray shows healing, wrist movement improving. 3 months and nearly full function, back to daily task. Monitoring, watching for stiffness or tendon irritation. So in this discussion, we have seen about fracture, radius fracture, and it is also called as Colles fracture. This fracture commonly occur in older adults with osteoporosis. It occurred from a fall of an outstretched hand. The distal radius role in wrist stability required surgical fixation, that is the ORF case, open, reduction, and fixation also. And this is to ensure proper healing. Early therapy used regain the motion alignedly with its importance in the forearm function. So here in this class we have seen about these things. Basically a patient of 80-year-old female who fell and has a sharp scale of 6 out of 10, and then she was immediately reported to the hospital where we had diagnosed her with Colles fracture of the right distal radius. And for the treatment, we have given her initial care, surgery and recovery, and also the outcome was good. in the 3 months she's back to the normal daily task, and we have to look for the watch stiffness intent or irritation. In the next class we will be continuing with another case presentation. Thank you.